Now, I want to go over a few important topics, specifically neurological diseases that will be common and that you will most likely encounter in your NCLEX exam. And I want to go over specific vital contents that plenty of students stumble upon. And so let's go ahead. Now, let's talk about seizures. Now, as we all know, seizures is basically an abrupt, uncontrolled discharge, right, in the brain. And when the patient has a recurring seizure, we call that epilepsy. Now, remember the mainstay pharmacological medical management, right, or treatment for our patient with seizures is phenytoin or Dilantin. Okay. Now, the important thing that we need to know and basically focus on when taking the exam and dealing with pharmacological management or treatment is knowing the fact that corresponds to our meds. Okay, and that means the knowledge of, let's say, the safe range levels, and more specifically with the medication Dilantin, since the therapeutic range has been known to pop up a lot on an NCLEX question. Okay. Now, the generally accepted therapeutic range for this drug would be about 10 to 20 micrograms per liter. Or if we are using milliliters, remember, it would be about 1,020 micrograms per milliliter. Again, take note of the conversion unit because that can be a silly mistake and it can cost you a lot on your NCLEX, right? Now, this drug should be injected slowly intravenously at a rate not exceeding 50 milligrams per minute. Okay? Now remember to take note of that again. This drug should be injected slowly intravenously at a rate of not exceeding 50 milligrams per minute. And also this drug should be administered slowly over 2 to 3 minutes. Okay? Now, back to our knowledge of this drug. We need to know and also understand the adverse reactions, right? Now, it's okay to memorize, but the best way to help you really embed facts and information into the long-term memory bank, right, which is very important, would be to understand the concept of how something is a result of whatever circumstances that happened, right? Now, now let's look at our patient, for example, with a seizure. Now, this patient is taking the drug phenytoin or Dilantin, right? Now, as the nurse, we need to understand that with phenytoin, it can cause the platelets or the WBC, our white blood cells, count to drop. Okay, so basically it lowers the blood count in our patient, which means that now our patient has an increased risk of bleeding or even a serious infection. Okay, therefore, knowing this as the nurse, it's important for us to be aware and kind of be mindful that when we are giving our patient this medication, we then need to constantly check our patient's blood works, right? Although other side effects such as gum hyperplasia, in which all we have to do is we need to make sure to tell our patients to brush their teeth often, right? And also ataxia, that's another side effect. And what's ataxia? It's basically an uncoordinated movement due to muscle control problems, right? And it basically causes the patient to have inability to coordinate movements, which can then usually lead to jerky and unsteady gait, or what we call like an unbalanced walking, right? So obviously our patient's safety would be very important, right? Now, as I have mentioned before, make sure to take note for the NCLEX the importance of knowing and observing our patient's blood cell count, since it's very important since it can lead to a suppressed immune system and obviously a risk for our patient having a serious infection. And also in the NCLEX, the term that might be used would be severe leukopenia, which just basically means a very low WBC count or white blood cell count. Okay, this is it for now. Again, thank you so much for spending your time, and I really do appreciate it, knowing that you have learned something that can help you eventually pass your exam, your NCLEX exam. And if you feel that you want to help support me with continuing doing all these NCLEX videos, just please visit my website at www.allnursingnotes.com. Again, that's www.allnursingnotes.com. And there's an NCLEX course in there that is available that has helped hundreds and thousands of NCLEX takers pass their exam. Again, thank you so much. I really do appreciate it, guys. Thank you so much. Good luck on your exams. I know you will do great, and God bless. Thank you.